Hello everyone, good afternoon. My name is Nisa Karel and I'm currently a second year Masters of Nursing student at Western Sydney University. Today I'm going to do presentation part of my palliative care subject assessment, which focuses on exploring the ethical and clinical dimension of voluntary assisted dying. In this presentation, I will critically discuss the four ethical principles such as autonomy, beneficence, non-maleficence, and justice as they relate to palliative care. I will examine both the ethical arguments for and against voluntary assisted dying and also highlight the importance of ensuring safety and delivering high quality care of patients who elect to undergo this process. Firstly, I would like to discuss about voluntary assisted dying. As voluntary assisted dying is a legal process that allows terminally ill and mentally capable individual of legal age to request and receive medication from a health professional to peacefully end their life through self-administration or with assistance from a doctor or a nurse. Voluntary assisted dying is currently legal and being implemented in every state across Australia. Uh, and ethical aspects of voluntary assisted dying should be considered through the framework of four core principles, which are autonomy, beneficence, non-maleficence, and justice. Uh, and in this slide, I'm going to discuss about ethical considerations for and against voluntary assisted dying. Firstly, I'll discuss about autonomy. Autonomy is defined as an individual right and ability to make decisions based on their personal values, reasons, and intentions. According to the Petersons and Dick, autonomy in the VAD is having the ability and freedom to make choices about one's death that reflects personal beliefs, motivation, and what one considers to be a meaningful and dignified outcome when faced with intolerable suffering due to terminal illness. Therefore, the capacity to determine the timing and method of one's on death is considered a fundamental expression of individual autonomy. However, some of the critics argue that autonomy in the context of voluntary assisted dying can be compromised as terminally ill patients may be influenced through pain, anxiety, or depression, which can impair their ability to make independent decisions. Additionally, the legalization of voluntary assisted dying may expose patients to external pressures, such as social pressure from family or society, which can further undermine the authenticity of their decision that may not truly reflect their autonomous will. Similarly, beneficence, the principle of beneficence refers to making clinical decisions that prioritize the patient's well-being by thoughtfully assessing and balancing the possible advantages and risks of each intervention. In this context, voluntary assisted dying can be seen as an ethical and compassionate option when patients with terminal illness experience persistent pain or emotional distress. Therefore, adopting a compassionate and ethically sound approach is crucial for supporting end-of-life patients by improving their well-being and reducing discomfort. On the other hand, some of the opponents argue that beneficence will be better achieved through ongoing palliative care, which is crucial instead of assisted dying, as well as experts in palliative care argue that most forms of suffering can be relieved through emotional and spiritual support. Similarly, non-maleficence is the ethical principle that prohibits causing harm to others without a justifiable reason. Non-maleficence is used to ethically justify voluntary assisted dying in situations when it aims to prevent severe unrelievable suffering in terminally ill patients, while if continued treatment prolongs pain or suffering, allowing the patient to choose a peaceful death may be the most compassionate and least harmful option, where harm is avoided by relieving patient from prolonged distress, respecting their right to dignified end. On the other hand, critics argue that voluntary assisted dying inherently contradicts the principles of non-maleficence as it involves deliberately ending a life, which can be viewed as a form of harm, even if the intention is to relieve suffering. Some believe that there should not be a means of avoiding pain when palliative care option exists. As well as there are also concerns about unintended consequences such as misuse or psychological pressure on vulnerable patients, which can lead to irreversible harm. Furthermore, justice, which refers to the fair, equitable, and appropriate allocation of healthcare resources and treatment among individuals. In the context of VAD, justice involves ensuring fair and appropriate access to assisted dying by applying ethical criteria such as need, equality, and contribution. Though balancing these principles can be ethically and practically challenging, however, justice can be undermined in VAD when healthcare resources are unequally distributed or when clinical decisions are influenced by factors such as provider benefit, institutional convenience, or societal bias rather than the patient-based interest, which raises significant ethical concerns, particularly for vulnerable individuals who may feel pressure to choose for VAD due to inadequate access, palliative care, and emotional support or culturally appropriate services. Furthermore, in this slide, I'm going to discuss about safety and quality of care for VAD patient, which involve physical care, which is one of the most effective in maintaining safety and quality care for the patient undergoing VAD. This involves managing pain and symptoms to ensure the patients remain comfortable and free from distress. If pain is not properly controlled, it can lead to emotional suffering and negatively impact interaction with loved ones and healthcare providers. So, care providers will be educated about the signs such as restlessness, sleep disturbance, or crying and administer prescribed medication accordingly. Medications such as opioids may be used to manage pain, while side effects must be closely monitored. Wound care and skin irritations such as dryness, pressure ulcer are necessary to prevent by maintaining hygiene and repositioning the patient regularly to prevent infection, reduce sore, and promote comfort. Additionally, ensuring proper food and fluid intake to maintain nutrition for the patient well-being according to their needs and preference is important. Preventing and treating infection is also essential to avoid complications that could reduce the quality of life of the patient, as well as temperature regulation during end of life declines, which should be monitored for signs of thermal discomfort. Therefore, these elements ensures that the patient physical comfort is maintained with dignity and safety. Similarly, psychosocial support is key component of quality care in VAD. Emotional changes like fear, sadness, or anxiety are common. For example, fear of unknown, being alone, or concern about loved ones, which can increase by lack of support or communication from family, friends, or healthcare providers. Effective, open, and compassionate communication is essential to make patient feel understood and less isolated, as well as providing comfort through gentle touch or peaceful environment. Soft music and involving patient in care decision can ease emotional distress. During end of life, being available, listening, talking, or simply sitting with person offers reassurance and help maintain connection, ensuring that their final moments are filled with dignity, empathy, and emotional support. Furthermore, cultural, spiritual, and financial need also important for high quality of VAD. Cultural safety ensures that care is delivered in a way that respects the patient's values, traditions, and beliefs, which create the potential impact on both health and illness. Spiritual support is also essential, which focuses on providing peace, meaning, and comfort through faith, reflection, or connection with loved ones, helping the person feel emotionally supported. Additionally, financial stress can harm a patient's well-being, so it is important to offer help through social workers or financial advisors to handle cost for treatment and end-of-life arrangements. Finally, the end-of-life care is also one of the most important for maintaining quality care during voluntary assisted dying, which should be provided through holistic person and family center approach that respects the patient's individual values and choices while actively listening, involving their loved ones, as well as a well-coordinated team of healthcare professionals, including doctor, nurses, palliative care experts, and support staff should work together to deliver care that is ethical, comprehensive, and properly managed, which help to ensure the patient receive compassionate and safe support addressing their physical, emotional, and social need during end of life. Therefore, voluntary assisted dying should be provided through a holistic person and family centered approach that respects the individual values and choices. Um, and these are the references I used through my presentation. Thank you so much for your time.